Assalamu alaikum everybody. We are live today, Monday morning. बहुत important morning. आज बहुत सारे decisions बनेंगे and आज मेरे साथ एक बहुत important guest हैं जिनका नाम Areesa Chinoy है, behavioral therapist हैं, BCBA हैं. And उनके बारे में मैं थोड़ा सा आप लोगों को बताऊंगी. She's an educational psychologist and उन्होंने अपनी training England से ली है. तो and she works Karachi and UAE के बीच में. So before I invite her onto the show, because this is not a show, but we are trying to promote whatever we can आप लोगों के लिए, आपकी सहूलत के लिए, आपकी बेहतरी के लिए, आपकी कन्वीनियंस के लिए. So before मैं उनको invite करूँ स्क्रीन पे, जो मैं आप लोगों से एक बात और एक गुजारिश करना चाहूँगी वो ये है कि मेरे पास बहुत सारे मैसेजेस आते हैं मॉर्निंग, मेरे पास बहुत सारे मैसेजेस आते हैं कि प्लीज़ गुफ्तगू उर्दू में रखिए, प्लीज़ आप उर्दू में बात कीजिए. तो देखें, इसका बहुत ही एक सिंपल सा सोल्यूशन है. सोल्यूशन ये है कि मैं उर्दू में बात कर सकती हूँ, मुझे कोई दिक्कत नहीं है उर्दू बात करने में, और ये मैं अल्फाज इस्तेमाल कर रही हूँ ताकि आपको पता हो कि मुझे थोड़ी देर लगती है उर्दू में फाइन ट्यून होने के लिए, लेकिन उसके बाद मेरी जो रफ्तार है वो सही हो जाती है. लेकिन बहुत सारे लोग हैं, बहुत सारे ट्रेनर्स हैं, बहुत सारे स्पेशलिस्ट, हम लोग बाहर के ममालिक से भी उनको हम लोग लाइव इन ट्यून कर रहे हैं, लाइव उनको स्ट्रीम कर रहे हैं. बहुत सारे थेरेपिस्ट जो इस वक्त यहाँ पे बाकी थेरेपिस्ट को ट्रेन कर रहे हैं वो उर्दू में इतने savvy नहीं है, या उनकी उर्दू की रवानगी इतनी अच्छी नहीं है, तो उनको वो हिचकिचाते हैं बात करते हुए, और उनको थोड़ा सा अनकंफर्टेबल महसूस होता है, क्योंकि वो शायद जो आपको समझाने की कोशिश कर रहे हैं उतनी फ्लुएंसी या उतनी अच्छे तरीके से ना समझा पाए. तो प्लीज बेयर विद मी, प्लीज बेयर विद द सिस्टम. और अगर आपको कोई इस तरह का सेशन जो आपको ऐसा लग रहा है कि ये आपके लिए बहुत ही ज़रूरी है, बहुत 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 अच्छा सेशन है, तो हमारे पास ये सहूलत मौजूद है. जैसे अभी हम लोग डॉक्टर महमूद का हम उर्दू में ट्रांसलेट कर रहे हैं उनका इंटरव्यू, तो हम आपके लिए वो फिर उर्दू में ट्रांसलेट करेंगे. लेकिन ताकि रवानगी ना टूटे, सेशन का वो इम्पोर्टेंट लिंक ना टूटे, प्लीज बेयर विद अस एंड प्लीज रिमेंबर कि हम बहुत सारी ऐसी वीडियोस देखते हैं जो इंग्लिश ओरिएंटेड होती हैं और हम उनको समझते हैं. तो लेट्स take in the information, let's be kind and let's be nice to our guest who's coming on. Assalamu alaikum, Areesa. How are you today?
Assalamualaikum. I'm okay. How are you?
Good. So, Areesa, I give a little bit of just a very brief introduction for you, but I would like to open the floor to you so that you can introduce yourself.
Hello, everyone. I'm an educational psychologist. I trained in the UK. I worked there in London for a few years before I moved to Dubai. In Dubai, I trained to become a BCBA. And over the last year, I've moved to Karachi, and I'm between here and Dubai. I work in Dubai supervising other therapists. And in Karachi, I work at Parkview Clinic. I think most people know it as Dr. Nasiruddin's clinic. But yeah, so that's a brief summary. And I work with children with behavior difficulties. I work with siblings of children with special needs. I work with children, primarily I specialize in adolescents. So I work with children who are older. I work with both verbal and non-verbal children. And I focus on ABA, but I am also I also deal with cognitive behavioral therapy in children. So that's a brief summary about me.
Thank you so much, Areesa. So, Areesa, today I kind of formulated my talk with you because बहुत सारे जो हमारे parents हैं, they don't understand कि how many different types of therapies are available. And because itna lack of exposure hai, and I know I've been grateful enough to have met you and have worked with you very briefly, but um, the thing is that therapy in the real world is a different picture, right? And when you say adolescent, I know कि हमारे बहुत सारे viewers हैं who don't even know कि adolescent की क्या ages हैं. So can you tell us what is the age group of the primary school goers, that age group, and the adolescent age group? What is that age group?
Adolescence deals with teenagers. So we start with from age about 13, 12, 13, and it goes up till 19. But with children with special needs, adolescence actually qualifies till children up till the age of 25, as long as their mental age is below 19. And you can essentially find out things like the mental age by doing cognitive assessments, just to rule out which exact age the child would fall into. Whereas primary school is anything, well, the younger years, you'd have early years between ages till age 5. So generally early intervention deals with children as young as 2 till about age 5. And then you would have the second batch of children from age 5 till about age 12.
So today, what I want to discuss with you, Areesa, is because I know you are very well versed in behavioral therapy, which is what you do.
Yeah.
I want to highlight anxiety and OCD. जिनको OCD का मतलब नहीं पता, obsessive compulsive disorder, जिसको उर्दू में कहते हैं जुनूनी मजबूरी. Now जुनूनी मजबूरी सोचें कि अगर बार बार कहेंगे तो कितना awkward sound करेगा, लेकिन what are one of the main recurring issues when you are working with adolescents and even younger children? What do you see in terms of OCD in children?
They present differently in different ages. I would say that anxiety, depression, things like this look very different in children than they would do for us. Children are not necessarily crying the whole day. Children are not depressed and unable. The way we are, when we are sad, we cry, we lose our appetite, we gain the appetite too. We do many things that we understand as, okay, yeah, that's me feeling sad. Children are not necessarily like this. Children don't have that awareness of themselves the same way that we do. We label our feelings very clearly. We think that, yes, this is me feeling sad. Whereas children, they tend to lose their appetite. They tend to have different kinds. They have body aches. So if you find, especially special needs children, when they're younger or older, they present anxiety very much the same way. They tend to have headaches. And if you take them to the doctor, there's no real root to the headache. They have stomach aches. They have, and they keep pressing their stomach and trying to show you that they're feeling uneasy. A lot of the times, that's how anxiety presents with children. Our children probably experience social anxiety the most, I would say. Children who express, a lot of us, when we go into a social scenario, we already know a set of rules of how we should be behaving in these settings. Whereas children don't sometimes know those rules automatically. So if you put them in an environment that they're not used to, they tend to feel more overwhelmed. With things like change, a lot of our children feel, and they can do very various things. Different children will show their anxiety in different ways. Some children will pace up and down. Some children will keep biting their nails or pulling their hair or doing something physical. I would say that to detect whether a child feels anything uncomfortable, you should be able to see it. There will be certain behavior things they do that you can see that is out of the ordinary. And it becomes a problem. It becomes something that you need to tackle when those behaviors are stopping them from functioning in the daily life. So if they're pacing up and down, it happens for 5 minutes and it's very rare, it's not something you necessarily need to target. But if they're doing it all the time, they're not coming to eat, every time they sit down to have breakfast, they're pacing, when their function of daily living function becomes disrupted, any behavior that you look at, that needs to be fixed only then.
So and मैं इसको थोड़ा सा ट्रांसलेट करूंगी कि अगर बहुत 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 दफ़ा ऐसा होता है कि आपका बच्चा कभी कभार कोई बिहेवियर शो करेगा and that can be absolutely normal and regular in the daily routine. लेकिन अगर उनकी इंडिपेंडेंट फंक्शनिंग जो है, जो उनकी डेली रूटीन या डेली लाइफ की फंक्शनिंग है, अगर उसमें दिक्कत या अगर उसमें बार बार कमी बेशी आपको महसूस हो रही है जो आउट ऑफ द नॉर्म आप जिसे कहेंगे, तो फिर आपको उसको एड्रेस करना और इंटरवीन करना बहुत जरूरी है. नाउ टॉकिंग अबाउट किड्स फेसिंग देयर फियर्स, ठीक है, जो बच्चे अपने जिन चीजों से उनको डर लगता है एंड थिंग्स दैट दे फील ट्रैप्ड बाय, there is a lot of behavior that comes out then too. So yeah, when we are talking about children who show behavioral symptoms because they are actually fearful or they are being tortured or bullied.
Yes, so that's yes, there are so many underlying reasons, but the way I would approach something like this is if you take one of us, and if one of us are bullied, we would show it in a certain way. When children show it we learn ways to self-regulate. We learn, oh my God, this is happening to me at work. When I come home, I am going to detach. I'm going to read a book. We learn ways for us to cope. Children don't learn those ways. So that's where we intercede. We actually sit and teach them strategies to cope. And, whether it is a parent sitting and talking to the child, it's a parent giving the child strategies. There are many ways we can go about it, depending on the cognitive level of the child. But a lot of our children have a lot more self-awareness than they do have expressive language. They may not be able to explain to us exactly what is going on, even though they understand a lot of what is happening to them in school or, with different members of the family. It can be anything. But I think that's where we actually need to be teaching our children to regulate.
And, one of the things when we talk about regulation is that evidence, and I'm talking about a lot of stats based around therapy and behavioral therapy, show their effectiveness when it is placed in a real setting. So how do you work with the real setting challenges? Because when a child is being brought into your clinic or your place of work, and you want to experience cognitive behavioral therapy or exposure therapy with them, so how would you highlight, after being in talk with them, with the child, how would you highlight day-to-day challenges with them? For example, now let me give you an example. There is a child who's a teenager who is being bullied in school or in college because she has BO. BO को कहते हैं जिस्मानी बदबू, जो बहुत सारे जो बच्चे हैं वो इससे सफ़र करते हैं क्योंकि घर में हाइजीन नहीं सिखाया जाता, and hygiene is a huge issue right now. So a child, she has been bullied in school for BO, body odor, and that has triggered some kind of an OCD behavior. How would you talk to that girl?
You would need to identify the root. My guess is that if she has been bullied before and she's not getting bullied now, she may not actually make the connection. She may not necessarily know that is the reason why this is happening. So for something like this, you would need to take a behavior history. Okay, you would need to focus on when her parents started observing a change. When you would focus on both, where other people are reporting her behavior as well as her herself. Most children don't see their own behavior the same way that their parents would. And so you would need to find a common ground before you start off with. But having said that, I would target it straight away. I would target, because if she comes to me and I don't necessarily know what's wrong, then I would need to find a proper history. And then cognitive behavior therapy involves changing the way you think and how it's coming out. So people who feel anxious see the world very differently to the way it really is. And cognitive behavior therapy involves a lot of structuring of your thoughts. So in a lot of ways, it would be getting a child to write down what's wrong. If they write down what's wrong and read it tomorrow, they may not remember it the same way as they wrote it. So a lot of
like journaling a little bit.
Yes, you would work on focusing. And the other thing is when a child has anything, if they are,
I'm sorry, Areesa. This is a lady.
Okay.
Baba help you with the bandage, please? Okay. Thank you.
Yeah. So if no worries. So if a child has negative thoughts and you're worried about the negativity and you want to focus on the positive, I feel a lot of times what parents do is ask the child what's wrong. Sometimes we just focus on dwelling on the negative. We forget to teach the child how to be positive.
Yeah.
So, and that's over the years, that can become really, the child will learn to only complain. The child will learn to do other things instead of finding a way to be more positive. Mm-hmm. So with cognitive behavior therapy, we focus on more positives. So if a child is bullied, we would focus on, tell me 5 things that happened today that has been amazing. Then tell me only 1 thing today that was not so amazing. You will find that children who are upset or they have so many negatives to share, they don't necessarily have anything positive to share. When you put them on the spot and they have to think of something about the day that was good, you actually encourage them to be more positive.
Yeah. And this is where I want to bring in what's happening at home. Because essentially a lot of times, jo ghar pe ho raha hota hai, that is the actual trigger to the child's behavior upfront. And parents हिचकिचाते हैं इसको address करने में because obviously nobody wants to spill their dirty laundry out in public. So nobody wants to admit if there's domestic violence going on at home, if the father is beating up the children, if the father is beating up the mother, if there is no money at home. These are real-time, real-life issues. And a lot of times when the children will come in dirty uniforms, they'll be disrupted in school, and you start talking to them, that is when you understand the root cause of their behavior, where it is stemming from. Do you think, how important do you think it is for more behavioral therapists to be placed in schools so that they are available for children?
It's actually the ideal scenario, because as a behavior therapist, when you walk into a situation, when I meet a parent now, the parent has already accepted that there's a problem because the parents are bringing the child to me. So when they come, they already know there's something wrong. They're already open to getting something done about it. But by then, the problem is already there's a history of that problem existing. You know, by the time they come to me, the child has been this way for 6 months, for 1 year, for 5 years. You have a lot of, but BCBAs across the world, there are not very many that are placed in schools. Even in the US, there's only a handful because most BCBAs are consultants. So we work by parents or schools calling, and then we go in and give advice. I actually also work for a British overseas school here, where I am actually in the school, and the benefit that I see for myself is that when I walk into a school, I can assess a problem before it has escalated. So the strategies that I put in place happen way before it becomes a big problem. Whereas in a clinic setting, when I meet a parent, the problem takes a much longer time to be regulated.
And then when you are already in place in school, what kind of training do you offer for the teachers, or do you work independently?
No, so I work primarily with the teachers. I don't work directly with the students. What I do is I assess, I do observations, and I come up with strategies for teachers to put in place. Because at the end of the day, I'm a consultant. I'm not there for the whole day. Obviously, the teachers, the students need to be listening to the teachers. The teachers need to have strategies to deal with it. Because if I find a lot of the time the children listen to me, it's 45 minutes, 1 hour. When I leave, the behavior restarts. Yeah. And this is why it's so important when I work with behavior that parents are implementing the behavior plan. It's not enough for me to do it. I can give the guidelines, but if the parents are not following through, the behavior doesn't really change.
Now, one of the other interesting therapies that is practiced in other places in the world, which is parent-child interaction therapy. And I hope that a lot of people on the group know about this. Like, I don't know how many parents actually do know about parent-child interaction therapy. Would you like to talk about why parental involvement is essential in progress for the child?
Yes. So at the end of the day, when you look at the child spends the bulk of the time with the parent, okay? Whether it is after school, whether it is on holiday, at night before going to bed, a lot of the behavior and a lot of the child's regulation needs to happen at home with the parents, because the parents are always going to be there. Whether it's a grandparent, so parents who work, grandparents are the same. But the problem is that a lot of the time, parents bring kids to the therapist and they expect to see a change at home, even though it doesn't always translate. In fact, behaviorally, if you look at all the research actually indicates that when a behavior improves in one setting, it usually becomes worse in the other. So you will have a lot of cases where kids are fantastic at school and at home they are a menace. You have situations where they are just so different. So children who are very, very good at home, maybe when they go to school, they're a little bit more disruptive. They're small things. The behaviors are not always matching. So for that perspective, yes, when parents get involved, I see progress immediately because we're tackling the behavior in more than one setting. And when a child learns that you are consistent, they will listen. So if they know that if I do this with this therapist, she will always behave this way. When parents do the same thing, it matches. The progress just becomes much quicker.
Yeah. And I can say this because my child has started pointing regularly now. So and I think one of the wonderful things about having worked with you was that you were one of the first therapists who, when I met with you, said to me that here is the plan. This is what we are going to do. These are the amount of sessions which I think will be required for your child. And then on, you have to work at home. There was no, okay, I'm going to do this long term. We're going to do this for years. You gave me a plan of action, right? And I think that really lacks ascension in our community, where parents forget that, you know, we're only going into a session for a little while. जो main काम है वो उनको करना है जो बाकी 23 घंटे हैं. We have two questions, Areesa, which I want to address before I continue with you. What major problems do growing children, adolescents face while growing up? I guess they're asking what are one of the main issues that adolescents face while they're growing up. I think we can direct this to differently abled teenagers.
Okay. Well, puberty is one. Your body changes, and those types of things causes a lot of different expression in different ways. When a differently abled child grows up, they experience a lot of changes that they don't expect because they function on routine and structure and knowing the facts. When the facts change, they tend to transition. Change tends to be a difficult one for them. So they can be a little bit more aggressive. You can see different types of behavior that may come out, whether it's the mood, it's the appetite. To be honest, normal teenagers also experience this. But the catch is that with children, regular children, they tend to have a close-knit group of friends, or they have cousins, or they have...
I think it's lagging a little bit.
Oh. Can you hear me?
Yes, now I can.
Okay. So I feel like a lot of the problems with adolescents who are differently able and typical neurotypical. Can you hear me?
I think it's lagging a little bit.
Okay, I'm just...
Okay.
Now?
Seems to be fine now.
Yeah? Okay. Yeah, your face got clearer. Okay. Yeah. So a lot of the time, the problems are the same. I wouldn't say that the problem with a differently able adolescent and a neurotypical adolescent is different. I would just think that the way they address the difficulties is different. So sometimes when you are a neurotypical child and you go through things, you have friends, you have a wide social network to let out your frustration. When you are a differently abled child, your network of people your own age tends to be much more limited, and therefore you tend to be addressing a lot more of your issues to the very, very secure people in your family. So I would say that the problems are very, very similar. It's just that sometimes parents feel that it's different. It's just the way we address it needs to be a little bit different.
And rightly said, the main fundamental problem is कि हम अपनी society में, हम अपनी community में, हम अपने मुल्क में puberty, sex, touching, masturbation, all of these things, we don't address them, even though bodily fluids flowing out of the body are absolutely essential and absolutely normal. I mean, if you were to block them and stop them, that is abnormal. And yes, a lot of parents, that's why struggle. Sophie over here asked, how should parents help transition, especially with boys with physical changes? And I know for a fact that she could be addressing the fact that perhaps the child is beginning to masturbate. And how does the mother, who is the primary caregiver, now address this fact?
I mean, I feel the best way to address something like this is to be open, encouraging an open communication.
Are we back?
Hello?
I'm here.
Hi? Okay. Okay.
The screen will handle the content which is coming on, I think.
I'm not sure what. Okay. Can you hear me?
Yes.
Okay, perfect. I feel the main thing about things like physical changes and children growing up is parents need to encourage an open communication. Whatever it is, it's the safety of your child, and it is much better for the child to approach you and ask you questions, and for you to keep that line of communication open, and for you to be accepting, for you to listen. These are much safer things than for a child to find out the information elsewhere. So as a parent, parents should be more, they should encourage it. They should give all the information one step at a time, but it's important that the child feels that you are the person that they can approach when something happens, or when they don't understand something, or when they feel frustrated.
Yeah. And having said this, a lot of differently abled children, I mean, it's difficult as it is for young girls who are experiencing menstrual cycles. For children who are differently abled or on the spectrum or OCD, when they embark upon this journey, how can parents with children who are slightly on the OCD behavioral or disorder side, how can they intervene quickly with their girls?
It's about giving advanced preparation. If you know your child is the type of child that struggles with the break-in routine, actually this is the perfect time to know. You would know right now with the break-in routine and every child having to stay at home, you will know which child is more likely to be sensitive to things like that or not. It's important that you give them the information before they experience it. So in the case of any sort of physical, if you start telling your child from a certain age that, look, these are the changes that may happen. You know, you can start off small. You can start with basic things they already know, like their hair going long, them going taller, things like that. Things they know, changes that will happen. And you would transition to things that they can't see yet that will also change. You know, with whether it's different parts of their body will develop differently. But it's very important that we are the person, especially in a country like this, or in the UAE as well, therapists cannot address these kind of areas. What we do in UAE is that we teach the parents how to address it. So for the safety and security of the child, we are giving the sort of a manual of how you should approach it, what the type of weeks between topic 1 and topic 2. But parents are the ones, they're the safe people to address this kind of thing. And just to give preparation. children with OCD need that advanced preparation. They need to know it's coming for them to tolerate the feeling that happens when it suddenly comes.
And Uruj here asked that what is the right age to start explaining about physical changes for, I guess, for girls and boys?
It depends. I would say I would go based on your child. There's no specific age. But if you know you have a girl and she's slightly bigger, or she looks like she may develop earlier, or if there's a history in your family of developing earlier, you would approach the subject at an earlier time. If you feel like, oh, she's petite, it's likely not to happen right away, then you can approach it slowly. But I do believe that approaching the subject as a parent and starting to share these kind of things for them to prepare for is a very good thing, because a lot of our children cannot deal with unexpected. The unexpected is too overwhelming for them. When we give them what to expect, you take away half of that anxiety, because when it happens, they already expected it.
Yeah. And मैं इधर बताती चलूँ जो सब सुन रहे हैं और जो बाद में देख रहे हैं कि आलिया पैदा हुई थी जब मेरा बेटा तकरीबन 3.5 साल का था, एंड 3.5 साल की उम्र तक आर्यन को किसी भी और सिवाय घर वालों के किसी और बंदे की कोई एक्सपोजर नहीं था. तो जब मेरी आलिया की सर्जरीज शुरू हुई और बहुत घंटों और लंबे दिनों तक मैं हॉस्पिटल में थी और आर्यन घर पे अकेला था, 3.5 साल के बच्चे को मैंने समझा दिया था कि बेटा ये वाली चीजें हैं जो कोई छू नहीं सकता, ये वाली चीजें हैं जिसको आप कोई अगर हाथ लगाएगा तो आपने मुझे आके बताना है, क्योंकि कोई भी सिवाय मेरे इस वक्त कोई भी आपकी इन खास जगहों को छू नहीं सकता, आपको कोई मुंह पे प्यार नहीं कर सकता, और अगर कोई जबरदस्ती करेगा तो कभी ये मत फील करो कि आप मुझे आके नहीं बता सकते, क्योंकि आप मुझे सब कुछ बता सकते हो. सो फ्रॉम देन ऑन, एंड आई एम टॉकिंग अबाउट न्यूरोटिपिकल चाइल्ड डेवलपिंग, उस वक्त से जब से उसको स्क्रोटम में बॉल लगी, उसको कोई इच हुई, उसको बट में रैश हुआ, वो मुझे आके बताता है. और मैंने उसको बहुत ही एक पोकर फेस के साथ हर चीज को बहुत ही एक नॉर्मल सी का एक उसको एनवायरनमेंट दिया कि बेटा यही नॉर्मल है, मुझे आके हर चीज बताओ, ये नॉर्मल है. एंड पीपल वुड बी लाइक योर चाइल्ड इज टॉकिंग टू यू अबाउट एवरीथिंग, एंड दैट इज द नॉर्मल फॉर अस. Having said that, Alia, who is obviously उसके milestones थोड़े से पीछे हैं और वो नहीं हर चीज समझ पाती, उसको मैं जब से वो 2-2.5 साल की थी उस वक्त से समझा रही हूँ कि nobody can touch you. And Areesa, in front of you, I had demonstrated something long time, and we are off. Areesa, can you hear me?
Yes, now I can. Yeah.
It's like playing hide and seek with us. A couple of months back, I had demonstrated where Alia knew her body parts, right? Yeah. And it wasn't for me, for her to know the body parts, importance उसकी वो थी कि कोई उसे गलत तरीके से ना छुए, हालांकि वो मेरी आंखों के अलावा इधर उधर कभी भी नहीं होती. And so what we as parents place essential and as normal, what we consider normal, our kids are going to consider that normal. Very quickly, I want to wrap up the session because I know you are a busy lady, Areesa. Where does you set reward systems? I know that in your practice you set reward systems. How important is praise and kindness, do you feel, that parents should practice with their children?
It's very important. Just the praise and the kindness. Children learn mostly by imitation. Children, you will see that if they go to school and one boy does something at school, they imitate that act and come home and do the same thing. A lot of parents go to schools complaining that their child has copied some other inappropriate behavior that they've seen someone else do. It's very much the same. When we behave a certain way, and our child will take on how we behaved and how everybody else has reacted to our behavior. And so a lot of our children, if we are looking to have the child behave in a certain way, they need to see it happen. It needs to be the norm. Just the way you said, it's the norm for a child to approach you and tell you if something is wrong. This is also the norm. It's the norm for the child to follow what the parents are doing, to follow what the sibling is doing, to follow what friends are doing. And a lot of times the exposure, when they imitate something inappropriate, we're teaching them not to. But a lot of the times when it is us doing it, it's much harder to teach them not to do it. So it's so important that we treat our children the way we want them to treat everybody else, not just us. Rewards and reinforcement is very important. It's why all of us do things that we do, whether it's something like going to work, anything. We do it for the reinforcement. So if a lot of the time our children may not understand praise and things like that, so we would be introducing a reinforcement they understand, and we would be accompanying it with that praise so that they understand the concept of what that social reinforcement. So I think it's very important, and I think it's why children do the things they do and why they do it again and again. It's also because they got something out of it when they did it the first time.
Very, very aptly put. And coming down to where we are currently, हम इस वक्त lockdown में हैं. We are at home. A lot of children who have behavioral issues, who have sensory needs, who have a lot of manic conditions where they could be facing or struggling with depression or bipolar or personality disorder. And these are grave things for parents ke liye, who are at home right now with their children and they are struggling. What kind of calming techniques or what kind of techniques could you sort of give them briefly so that they can handle pressure at home currently?
For me, the one thing that I think all the parents should look into doing is coming up with a quiet space in their house. It can be a corner of a room. It can be any area in the house that you lay out like pillows and blankets. So it's a place where the child can go if they need to just decompress. There are so many things taking place in the day, and there's so many things that are different to what they know. You're giving them a safe space to kind of go and just unleash so that you're trying to limit tantrums. You're trying to limit a lot of those types of things. Mm-hmm. And right now I know a lot of parents are either very stressed and not giving screen time or being really careful not to. It's not a normal time. It's not a concept of, yes, you can't touch the screen, or I feel like at this kind of time everyone needs to be a little bit more flexible. There's obviously a lot of change happening. So if you are looking at planning your day, that would be the best thing for children, because our children need routine, and the routine doesn't need to be the same. So in the morning, if you sit down with your child and you come up with 3 or 4 things that they want to do and 2-3 things that you want to do, and you make it into, oh, let's do this and then we'll do this, you're giving them some structure. They don't have that anxiousness of what's going to happen next, because you're giving them what's going to happen next. The other big thing is I feel like that a lot of our parents may feel like this is loss of teaching time. This is loss of learning time. It's not, because our children are at home and they're learning just a different set of instructions. They're not learning maybe academic things, but there are other life skills that they are learning in this kind of time. For children who have any sort of emotional difficulties, I personally would recommend a parent-child time towards the end of the day. Things like, for 5 minutes in the day, you're promoting your child to share things that they're worried about. You're promoting your child to share things that they enjoyed about the day, just because you want to make sure children, as much as they can, are verbalizing what is wrong. You never want the child to be thinking and overthinking, especially right now, all of us are thinking and overthinking. But for our kids, we need to try to make sure that it's okay to be worried, but you should tell me when you're worried. That's the main thing I feel that we should be focused on.
And I know that you said that quiet space or a sensory corner for children. Just to highlight, for non-verbal children.
Actually not necessarily, although I suppose teenagers have their own room and maybe they will go in, and that's fine too. But it's all the same concept. It's just how it looks that would be different. So for children who are I mean, small things. If a child, it's their time to play, you wouldn't necessarily put 4 or 5 activities down and be like, okay, now you're going to play, because you're hoping the child will go from activity 1 to activity 2 to activity 3. That rarely happens. Usually what happens is when you lay out so many toys and when they're in the room with so many different activities, they pick one and they're overwhelmed. So small things like you would lay out 2 things at a time so that they are selecting and doing what they want, but you're telling them whenever things are too much, you can go here. So for children who are young, whether they are verbal or nonverbal, for them to know this is their area that they can just go and lie down and hang out, that's great. For teenagers, for them to know whenever things are overwhelming, you can take a break and you can go to your room and you can hang out, you know, things like that. They're the same concept. It's just how they look that would be a bit different.
Great. Thank you so much, Areesa, for, really addressing so many topics that essentially we are so scared and hesitant to address. Before we sign out, would you like to say anything to parents essentially who are cringing under lockdown and saying, okay, we need to get her on board? How do we get to Areesa, or how can we access therapy with Areesa?
Right now, I'm doing therapy for parents to do the therapy with their child. I'm not taking on any child specifically. What I'm doing is I'm doing telehealth therapy, but I'm dealing primarily with, I send a list of goals and parents are carrying it out themselves with me watching, which I think is actually the end goal anyway. So for some kids, it's quicker now because the parents are doing things all day long. Having said that, I'm at Parkview Clinic. So in general, that's where you would make an appointment to see me. The only thing
is in Karachi, and it is right behind Auntie Park. Jinko nahi pata hai, Karachi Clifton area mein wo Auntie Park ke piche hai.
Yes. The only thing I would recommend for parents, I think this has been an amazing thing you're doing, because you're letting parents schedule in a time that they can take a break from the overwhelmingness of everything else that's happening. And it's actually the biggest thing. I feel like a lot of times our parents are so focused on doing things with our children, we don't realize that everybody actually needs a break. And for you to have scheduled hours in, I feel like you're giving parents some sort of routine to be able to be like, okay, this is my learning break, you know? So yeah, that's all.
So that means I need to get you back, Areesa, so that you can have some more praise for me, and I'll be like, this is my time. Areesa is going to say some nice things. But no, I really, I'm really grateful. Thank you so much, Areesa. I hope जिन parents को दिक्कत हुई समझने में, अगर आप sexual changes, growing up, tantrums, इन तरह की चीजों में अगर आप ट्यून इन करना चाहते हैं तो आप प्लीज मुझे मैसेज करिएगा, ताकि जो अरीसा ने बोला है हम उसको ट्रांसलेट करके आपके लिए प्रोवाइड कर सकें आपको इधर. So thank you so much, Areesa. I hope that you are safe and you have a great day.
Thank you. I hope the same for everybody.
Thank you so much.
Thank you. No problem. See you. Bye.
So that was Areesa Chinoy. जो लोग tuned in थे, I hope that this was a very, very informative session. जिन लोगों को थोड़ा सा समझने में दिक्कत हुई, अगर आप message करें तो I have a bunch of people. I know Aruj was listening. I know a couple of people जो सुन रहे थे. Obviously मैं भी सुन रही थी. और अगर आप चाहते हैं कि आपको ये दोबारा समझाया जाए उर्दू में, तो please reach out, ताकि हम आपको वॉइस नोट भेज सकें या आपको मैसेंजर पे वॉइस नोट भेज सकें. इट्स वेरी इजी, इट्स वेरी सिंपल. बट अरीसा ने बहुत ज़्यादा इंटरेस्टिंग बातें करी. उन्होंने बहुत इंटरेस्टिंग टॉपिक्स को टच किया. उन्होंने हमें बताया कि देखें, जो हम अपने बच्चों के सामने, स्पेशली टीनेजर्स के सामने, जो हम प्रैक्टिस करेंगे फिलॉसफीज, जो हम एटीट्यूड्स प्रैक्टिस करेंगे, जो हम उनके सामने बिहेवियर प्रैक्टिस करेंगे, वो ही बिहेवियर ट्रांसलेट होके वो हमारे साथ प्रैक्टिस करेंगे. सो अगेन, बच्चे जो अपने फियर फेस कर रहे हैं, जो OCD से गुजर रहे हैं, जो इमोशनल डिसऑर्डर्स को एक्सपीरियंस कर रहे हैं, उनसे बात करें। जितना हम अपने बच्चों से बात करेंगे उतना ही उनका हमारे अंदर ट्रस्ट और बिलीफ ज़्यादा पुख्ता होगा। और अगर हम अपने बच्चों को ये कहेंगे कि अरे ये क्या कर रहे हो तुम, ये मत करो, ये गंदा है, ये नहीं करो, अरे हाय मत छुओ, तो ऑब्वियसली वो इसको और रिपीट करेंगे और हमारी बात बिल्कुल नहीं सुनेंगे। तो अगर हम उनको समझा सकें कि ओहो अच्छा अगर तुम्हें इस वक्त इसको छूना है कोई बात नहीं, लेकिन इधर चलो बाथरूम में चलते हैं, चलो अपने कमरे में चले चलो, क्योंकि बहुत सारे हमारे पेरेंट्स एक्सपीरियंस कर रहे हैं, उनके बेटे बड़े हो रहे हैं जिनकी इतनी इंटेलेक्चुअल कैपेसिटी नहीं है कि वो ये सोच सकें या समझ सकें कि क्या हम इसको कमरे में करेंगे, क्या हम इसको गुस्ल खाने में करेंगे, या क्या हम इसको सबके सामने करेंगे। So to be able to address these things, to be able to address puberty, to be able to address maturity, to be able to address sexual needs, sexual desires, masturbation, ये सब चीजें real हैं, ये सब चीजें होती हैं। इनको दबाने से, इनको address ना करने से ये चीजें खत्म नहीं हो जाएंगी या ये दब नहीं जाएंगी। तो अगर हम चाहते हैं कि हम अपने बच्चों के साथ बहुत अच्छी तरह काम करें, अगर हम अपने बच्चों को समझें, तो उनको मौका दीजिए ताकि वो आपसे बात कर सकें, उनको मौका दीजिए ताकि वो आपसे आपके साथ ये चीज़ें एड्रेस कर सकें। एंड आई एम वेरी ग्रेटफुल टू माई पेरेंट्स जिन्होंने हर जो चीज़ जो मुझे कभी एड्रेस करनी थी, हालांकि मैं उनका सबसे बड़ा बच्चा थी और एक न्यूरोटिपिकल बच्चा थी, लेकिन उन्होंने मुझे वो स्पेस दी, वो जगह दी कि मैं अपने इश्यूज उनके साथ ओपनली और ऑनेस्टली एड्रेस कर सकूं। इसमें इस सिनारियो में मुझे वो फीलिंग मिल गई कि मैं अपने माँ बाप से कोई भी बात कर सकती हूँ। एंड दिस इज नॉट, like Areesa said, this is not just for the neurotypical kids, this is for any child, whether they are differently abled, whether they you feel that they cannot understand, they can understand. So please listen to the points that were given. हम वापस आएंगे 5:30 बजे। आज एक बहुत ही हसीन माँ हमारे साथ होंगी जिनका नाम है सायरा मुबीन, वो हमारे साथ होंगी 5:30 बजे। So please tune in and listen to her beautifully amazing story. Thank you so much for tuning in and see you at 5:30. Khuda Hafiz.